Have you ever heard a ringing, buzzing, or hissing sound in your ears when everything else around you is quiet? And it can actually be any sound under the sun. If yes, you're not alone. This condition is called tinnitus or tinnitus. Either pronunciation is correct. And for millions of people, it becomes a daily struggle. But here's the big question. Could this annoying noise be caused by hearing loss? I'm Dr. Shana Stapleton, board-certified audiologist, and in today's video, we're going to cover the real link between tinnitus and hearing damage. Stay with us until the end because we have answers that might surprise you. Tinnitus is one of the most misunderstood conditions out there. It's not a disease in itself, but a symptom of an underlying issue, often related to your hearing system. Research shows that up to 90% of people with tinnitus also suffer from hearing loss. But how exactly are the two connected? Is hearing loss always the cause of tinnitus, or are there other culprits? In this video, we'll break down the facts, explore the science, and give you practical tips to deal with tinnitus, especially if they're linked to hearing problems.
Understanding tinnitus. Tinnitus is the perception of sound in the ears or head without any external source. It may sound like ringing, buzzing, humming, clicking, or even a whooshing noise. This sound can be soft or loud, constant or occasional, and it can occur in one ear or both. There are two main types of tinnitus: subjective and objective. Subjective tinnitus, the most common kind, can only be heard by the person experiencing it. Objective tinnitus, which is rare, can actually be detected by a doctor during examination and is usually caused by a physical problem like a blood vessel disorder or muscle spasm. Regardless of the type, tinnitus is often linked to some kind of disruption in the hearing system. How the hearing system works. To understand how tinnitus and hearing loss are connected, it's important to know how hearing works. Sound waves travel through the ear canal and strike the eardrum, causing it to vibrate. These vibrations are then transmitted through the three tiny bones of the middle ear, the malleus, incus, and stapes in the inner ear. Thousands of tiny hair cells that move in response to sound vibrations and convert them into electrical signals. These signals travel through the auditory nerve to the brain, where they're interpreted as sound. When these hair cells become damaged due to noise exposure, aging, or other factors, they stop sending proper signals to the brain. In response, the brain sometimes creates phantom noises to make up for the missing information, leading to tinnitus. The link between tinnitus and hearing loss. Most people with tinnitus also have some form of hearing loss. This is not a coincidence. When the ear loses its ability to pick up certain frequencies, especially high-frequency sounds, the brain tries to compensate by increasing neural activity in those areas. This increased activity can result in the perception of sound, even when no sound is present. This is known as a maladaptive neural response. According to the American Tinnitus Association, hearing loss is the most common trigger for tinnitus. So yes, in the majority of cases, tinnitus is indeed caused by hearing loss. Causes of hearing loss that lead to tinnitus. Several common causes of hearing loss can trigger tinnitus. One major cause is noise-induced hearing loss. Exposure to loud sounds, whether from concerts, machinery, or headphones, can damage the hair cells in the cochlea permanently. Another cause is age-related hearing loss, known as presbycusis, which naturally occurs as we get older and often starts with high-frequency loss. Ear infections and blockages caused by earwax can also lead to temporary hearing loss and tinnitus. Additionally, some medications known as ototoxic drugs, such as certain antibiotics and chemotherapy agents, can damage the inner ear and result in both hearing loss and tinnitus. In rare cases, tumors like acoustic neuromas or conditions like Meniere's disease can also cause both symptoms. Can you have tinnitus without hearing loss? Although hearing loss is the leading cause of tinnitus, it's not the only one. Some people experience tinnitus without any detectable hearing loss on standard audiograms. This is often referred to as hidden hearing loss, where damage exists in the auditory nerve or brain pathways rather than the cochlear hair cells. Other causes of tinnitus without hearing loss include temporomandibular joint, TMJ disorders, neck injuries, chronic stress, high blood pressure, and even poor circulation. So while hearing loss is a major factor, it's not the sole cause of tinnitus in all cases. The brain's role in tinnitus. What's particularly interesting is that tinnitus is as much a brain issue as it is an ear issue. When the ears stop sending normal input, the brain responds by reorganizing itself. This process is known as neuroplasticity. The brain increases activity in the auditory cortex and other related areas, which can lead to the perception of phantom sounds. This is why treatments that target the brain, such as cognitive behavioral therapy, CBT, and tinnitus retraining therapy, TRT, are often effective. These methods don't fix the ears, but they help the brain reduce the perceived intensity of the noise or make it less bothersome. Diagnosing the connection between tinnitus and hearing loss. If you have tinnitus, the first step should be a full hearing evaluation from an audiologist. Standard hearing tests will check your hearing thresholds at different frequencies to detect any loss. In some cases, additional tests like otoacoustic emissions or speech and noise testing may be needed to uncover subtle or hidden hearing damage. If a structural issue is suspected, like a tumor or vascular condition, MRI or CT scans may be recommended. Identifying whether hearing loss is present can guide the most effective treatment options for tinnitus. How treating hearing loss can reduce tinnitus. Treating hearing loss can significantly reduce tinnitus for many people. Cognitive behavioral therapy, CBT, teaches people how to change their emotional and psychological reaction to tinnitus. Tinnitus retraining therapy, TRT, combines sound therapy with counseling to help the brain ignore the tinnitus over time. White noise machines, sound apps, and even meditation can also help people manage symptoms. In severe cases, antidepressants or anti-anxiety medications may be prescribed to help with the stress and insomnia that tinnitus can cause. Preventing tinnitus by protecting your hearing. The best way to avoid tinnitus or stop it from getting worse is to protect your hearing. Avoid loud environments or use high-quality ear protection when around machinery, concerts, or firearms. Keep headphone volumes below 60% and limit listening time to no more than 60 minutes at a stretch. Be cautious with medications that can damage your hearing and always consult your doctor if you notice any sudden hearing changes. Early prevention can save you from a lifetime of struggling with tinnitus. So, is your tinnitus caused by your hearing loss? In most cases, yes. The two conditions are deeply connected, and understanding that link is crucial for proper treatment and relief. But even if hearing loss isn't to blame, there are still plenty of effective strategies to manage and reduce tinnitus. The key is getting a professional diagnosis and following a treatment plan tailored to your specific needs. If you found this video helpful, give us a thumbs up, hit that subscribe button, and ring the notification bell so you never miss out on health content that could change your life.